Making time for our COVID briefing today. As usual, I will welcome Dr. Rahman for one of his guest appearances, but I'll start by asking Dr. Rosann Seviour, our acting CMOH, to give us today's update.
Thank you, Minister. Good afternoon, and thank you for joining us here today, and a special thank you to Dr. Rahman for taking time from his very busy schedule for joining us today for an update on COVID-19 projections. Since the last media advisory, we have 16 new confirmed cases of COVID-19 in the province. 1 is in the eastern region, and 15 are in Central Health region. All are under investigation. There are 4 presumptive cases in Central Health. There have been 11 new recoveries, 10 in Central Health and 1 in Western Health, leaving 164 active cases in our province. This brings our total number of provincial cases to 1,747. 7 people are hospitalized currently due to COVID-19. 1,556 tests were completed since yesterday for a total of 304,765 tests to date. As I have indicated before, our priority is to keep our schools open for the well-being of children. We are taking additional precautions to reduce the risk of spread among children who cannot yet be vaccinated. Effective midnight tonight, we will be making changes for children under 12 that travel into the province. For children traveling and following the vaccination status of their fully vaccinated parents or guardians. For the 14 days after arrival in the province, the children must limit contact with others by staying home as much as possible, avoiding vulnerable people, long-term care and personal care homes. They cannot attend daycare, camps, sporting events, and must avoid large, crowded settings. After day 7, those aged 5 to 11 can arrange for a test and will be permitted to attend school, but must still adhere to the other limitations, including avoiding before and after school programs until the 14 days is complete. For partially or unvaccinated travellers and their children under 12, travellers and their children must fully self-isolate until they receive a negative test result taken on day 7 or later. After receipt of a negative test result and until the 14 days of a self-isolation period has passed, partially vaccinated and unvaccinated travellers, as well as any children travelling with them or have isolated with them, must limit contact with others by avoiding staying home as much as possible, avoiding vulnerable peoples, long-term care and personal care homes. They cannot attend daycare, camp, sporting events, and must avoid large crowded settings. After receipt of a negative test result, children aged 5 to 11 can attend school, but must otherwise limit contact with others, as I just described, and cannot attend before or after school programs. Those younger than 5 are not required to be tested as long as parents have their test on day 7 or later, but are still required to abide by these limitations after the parents receive a negative test. I know this is a lot of information for parents to navigate, and we will have detailed information available on our website shortly to assist. If you have not been vaccinated or have not received your second dose, please do so to protect the children that cannot yet be vaccinated. Every dose counts, every person counts. We have your dose ready and waiting for you. Please make the time to get the shot. Today, the National Advisory Committee on Immunization, known as NACI, provided new recommendations for long-term care residents and seniors living in congregate living settings. This population is at an increased risk of infection and severe disease due to COVID-19. In addition, they do not mount the same immunity after vaccination as those who are younger and healthier. NACI recommends that residents who have also already received a primary COVID-19 vaccine series should be offered a booster dose at least 6 months after the primary series has been completed. Newfoundland and Labrador will be following these recommendations, and regional health authorities will begin planning for the administration of these boosters. Before I conclude, please remember that only essential travel is recommended into and out of regions that are under Alert Level 3. Examples of essential travel include medical reasons and for work. We strongly discourage anybody under Alert Level 3 from moving a social gathering to an area outside of Alert Level 3, as this may contribute to the spread of COVID-19 across our province. For anyone just joining us, there are a total of 16 new confirmed cases, and a total number of cases in the province to date is 1,747. Thank you to everyone doing their part and following public health direction. Please be kind to one another and stay safe. Thank you.
Thank you very much, Dr. Seviour. Dr. Rahman has been working diligently with his team since the start of the pandemic, providing us with modelling. And as we had suggested last week, we would arrange for him to come and provide an update. So I'd like to hand it over now to Dr. Rahman. Once again, thank you very much for your work, sir.
Good afternoon, everyone, and thanks, Mr. Haggie, for giving our predictive analytics team a chance to be here at the briefing. It's a privilege to be here with you. Thank you. Much of the work is actually being done by these individuals here, and I just want to personally thank them for their dedication and their time and their effort So what we're going to talk about today are three different things in this brief presentation. The first is to look at the current epidemiology of COVID-19 and just take a deep dive in a couple of aspects I want to point out. Secondly, as we talked about earlier, is to provide short-term projections of COVID-19 cases as well as ICU.
Dr. Rahman, can I interrupt for just a quick second? I think we're having some mic troubles with your mic. Just give us 1 second. We'll see if we can figure it out.
Okay, I thought it was me.
Sorry about this. I still think it's something I did, but I'm not quite sure. Regardless, thanks, Minister Haggie. And so what we're going to be talking about in the brief presentation today is just highlighting a couple of aspects regarding the epidemiology of COVID-19 in our province, as requested by the media, just short-term projections in terms of COVID-19 cases as well as ICU occupancy. And the rest of the time, I just wanted to look at and provide the rationale for why we need increasing vaccination rates in Newfoundland and Labrador, despite the tremendous success we've had to date. So regarding the slides that you're going to see, the numbers were crunched on Tuesday, and so the data from Tuesday and Wednesday is not included in this, but it's pretty recent. So the first thing that you want to see when you look at the COVID-19 fourth wave in Canada is that different provinces have had different experiences, but every single province there's been a rise in cases. This is no different for us here in Newfoundland and Labrador. And so if you look at the orange line here, we've certainly had an uptick, and as Dr. Seviour mentioned last week, we're in the midst of COVID-19, the fourth wave of COVID-19 here in our island. There's also been change regarding what's happened in the Maritimes, particularly in New Brunswick, where their 7-day average of new cases now is actually exceeding Ontario. And so we really need to be aware of what's evolving in the Maritimes as well, and not just in central and western Canada, as it'll certainly impact what happens here. When we take a closer look at the epidemiology of the fourth wave, you really wonder what's different about it as compared to February. In February, when there was an outbreak, this was the Alpha variant, and now over 80% of the cases are now due to the Delta variant. The Delta variant is nastier in some ways. It's a bit of a beast in terms of how quickly it infects individuals, and for those that are older or have comorbid illness, it's actually more severe in terms of complications related to the infection. The good news is, though, we have readily available vaccines, as Dr. Seviour has mentioned, and this can really help mitigate the spread and also mitigate large outbreaks if we all collectively get together and get vaccinated. So let's look at the week of September 20th and 26th, and this was our case count. It was quite high for that particular week. Primarily, the infections occurred in those that were not vaccinated. All age groups were involved, but there was a substantial portion of individuals that were older individuals that are getting the Delta variant, often that are not vaccinated, would mean greater hospitalizations, ICU, and regrettably we've had one death as well. The other thing to look at is the blue bar here, increased number of cases among kids that are not eligible to get vaccinated. And the best way to protect our young children is to make sure that the community transmission or the community around them has very little COVID. And so they're bringing in very little COVID into their schools. So it's imperative that we all follow public health measures and get vaccinated to make sure that this vulnerable population does not get infected. The source of COVID-19 is very well known to Newfoundlanders and Labradorians, being an island. The major source for us in terms of new infections continues to be travel. It's not really different for this particular outbreak. So what we really need to do is to be aware of where people are coming from and what the epidemiology of the cases are in terms of their destination that they're arriving from. So in terms of short-term projections, this was a time series event done by Dr. Loreto Asti, and it takes into account some of the public health measures that have been put in place. And the clusters that are there now that we're aware of, we're actually predicting in terms of short-term projections that the number of cases fall throughout the week. And this was done Tuesday, and this is what we've basically seen for Tuesday and Wednesday. This is not to say that there may not be another cluster, in which case the analysis would have to be redone. In terms of projecting based on the number of cases that we have, the ICU occupancy in Newfoundland and Labrador, there's a couple of really important determining factors. So if you look at, for instance, the Ontario Science Table, what they have stated is that if you're fully vaccinated, your probability or your risk of getting into the ICU is probably 60-fold less than if you're not vaccinated at all. And so vaccination status along with age are probably the strongest determining factors, along with comorbid illness. So based on these factors, we're able to predict to some accuracy what the ICU occupancy will be. And we're thinking for this particular outbreak at the present time, it looks to about 6 to 8 individuals within the ICU at its peak. So vaccinations, and this is sort of the most important part that I'd really like to highlight regarding the presentation, is the rationale why we need to increase our vaccination rate. So if you were to ask, what's the probability of me getting an infection from, for instance, an infected traveler? Well, this is the question that was asked by Professor Amy Herford at Memorial. And based on this modeling, what the result is that it all depends on your vaccination status. And so if you are not vaccinated, the probability of you acquiring a community infection from an infected traveler is about 20%, which is 1 in 5 if you happen to come in contact with them. Meanwhile, if you're fully vaccinated, it's down to 2%, in other words, 1 in 50. So a 10-fold reduction in infection number, a relative reduction that is similar to what's been noted in other jurisdictions, showing you the benefit of being fully vaccinated. If you just had one shot and you're happy with it, unfortunately, because of the breakthrough rate of our vaccines, the probability, if you're partially vaccinated, of getting an infection is still quite high at about 12%. So the best thing you can do for yourself to protect yourself from getting a COVID-19 infection is to be fully vaccinated. The other benefit in terms of vaccination is that you're also contributing to the population immunity threshold. This slide is just here for illustrative purposes, but it makes the point that the Delta variant has changed our goalposts in terms of what we actually consider to be a good vaccination rate for the population. So if you looked at the original variant, then if you were infected with the original variant, you may pass it on to 2 or 3 individuals. So that's the R0 value. With the Delta variant, the secondary infections now have increased significantly to 6 to 8. And so because of the increase in the reproduction number, if you look at a mathematical formula that actually graphs out, graphically displays the immunity that's required, it's increased substantially from the original variant or even the alpha variant, which is the outbreak that we experienced in February. So every single vaccination counts, because what we're trying to do is to get the number of Newfoundlanders and Labradorians to be vaccinated as high as possible to combat the Delta variant. So where can these gains be made? So absolutely, as Dr. Seviour had mentioned, if you just had one shot, please go ahead and get your second shot to be fully vaccinated, because that offers you much better protection, as we've demonstrated. The other places, when you look at other gains that can potentially be made, you need to look at, for instance, certain age groups. So if you look at the age group between 20 to 40, their full vaccination rate actually falls below 70%. That's an issue because it's not as high as others, but also this is a cohort that, regarding transmission, likely transmit the virus more because they are highly mobile. They have a lot of contacts. They're often seen in very large gatherings. And as a result, it's very hard for public health to try to trace down all their contacts. And speed is essential in terms of isolating an individual that's infected so that they can't secondarily spread another infection. So for these reasons, if we could step forward, particularly the younger age groups that are eligible for vaccination, it would really help limit the transmission, and so that we won't get as large numbers in terms of our outbreaks. What's the other thing that we can actually do is I think we need to really look critically at the various regions regarding vaccination. And so without a doubt, you can have an outbreak in any region in the province. However, if it's a region that has a lower full vaccination rate, and this is what the map shows, and the lighter the color, the less vaccinated, fully vaccinated they are, these regions are more susceptible, because if you have COVID-19 within this particular region, it'll spread to a larger proportion of individuals because they're more vulnerable. It'll spread quicker as well. And again, time is of importance in terms of contact tracing. And so you'll have larger outbreaks within those regions. So those regions with the lighter color are really more susceptible to getting outbreaks. So let's look at certain regions that are doing really, really well and ask ourselves, why can't we be like them? And, you know, it's just a challenge in terms of really getting your vaccination rate up, because at the end of the day, we all want the same thing: safe neighborhoods, and safe as in no COVID there, and also not for our kids to be infected with COVID. So very similar to what Premier Fury, Minister Haggie, Dr. Fitzgerald, and Seviour have been saying. We're really in the midst of the fourth wave of COVID-19 pandemic. Over the next week, they're expecting, unless there's new clusters that emerge, for the numbers to be falling, but we really need to follow this carefully. Travel continues to be an important source of new infections. We really have to be vigilant regarding travelers coming in, which I know we are. Locally acquired infections are primarily occurring among unvaccinated individuals. So vaccines protect you from getting infection, but also protect you in terms of not getting into having severe disease. There's a significant variation that exists in the vaccination rate among various eligible groups in geographic regions, and these are sites that we can hopefully improve on in terms of our vaccination. And without any doubt, full vaccination offers substantial protection against COVID-19. It's shown to be safe. It's effective in limiting transmission, and it's really, really effective in preventing serious health consequences related to COVID-19. So thank you, Minister, for your time.
Thank you very much, Dr. Rahman. Yesterday we spoke about the need for trusted information and consistent information. The information that you've heard today, both in terms of Dr. Seviour's changes to special measures orders related to travel and Dr. Rahman's presentation and the information there, will be available on our website by the end of the day. The presentation will also be up there. There is an interactive map, very similar to the one shown there about geographical areas. And we have seen positive response in Bonavista and Port Saunders, who have now moved from their previous lower ranking, as it were, to achieve over 80% with dose 1. You can see from the slide about the variants that our goalpost now for immunity is really in the high 80% fully vaccinated. We've passed that threshold nearly for dose 1, and we simply now have to get up there with dose 2. So again, my message, the same as everybody's here, is the best protection for you, for your community, and for your children is to get the shot and to get a full series. So with that, I'll draw to a close, and Leslie, I'll hand it back to you to moderate the media questions, please.
Thank you, Minister. For the benefit of our speakers, we have 2 media in person and 2 joining by phone. The first round of the question and answer session will give each reporter the opportunity to ask 1 question and 1 follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask 1 final question. Our first questions are from Ben Cleary with NTV. Please go ahead and make your way to the mic.
Hi, and thank you. My first question is, can you just walk us through the travel restrictions being put in place tonight and why it's important to focus on children under 12?
Sure. So one of the ways that we prevent the spread of COVID-19, there's 2 issues. As Dr. Rahman said, we have our introduction into the province, and then we have our transmission within the province. So the policies we've enacted both yesterday and today are to tackle those 2 things. As Dr. Rahman said, so in terms of introduction into the province, we've closed the Atlantic bubble, being cognizant of the changes in the epidemiology of the region this fall versus this summer. In addition, we've taken people who were partially vaccinated and we've moved them to the unvaccinated category, in knowing that as we see Delta spread, we have an increased risk of those people not being fully protected. So it protects them, and it also protects in terms of their ability to transmit. In terms of children, there's 2 things. So before, if you or parents were vaccinated and you entered the province over the summer, and we considered that provided you some barrier around you in terms of as a child, and then you didn't have to isolate. If you arrived into the province and your family was unvaccinated, your caregivers, those people around you arrived in, were unvaccinated, you had to isolate for 7 days and then test, and if you didn't get a test, you isolated for 14 days. So the changes that we've made is that now even if the parents are vaccinated, we do extend that children needed to get have a test at day 7 before they enter school. So with that, we're preventing that any sort of passage from a child to transmission in school. We're also extending that during a 14-day period, which we know is the incubation period and the period for which you present risk. We're also keeping children in terms of transmission, unvaccinated children, from being in areas where they could spread it, like visiting granny in long-term care, any large social gatherings, that kind of thing. And then for the group of people who come in and they're unvaccinated, and so there's effectively no barrier around those children, we still have them isolating and testing for 7 days. At 7 days, they can return to school, but the same requirements that we've put from day 7 to 14 around the vaccinated children, we've also extended to the unvaccinated children, so it applies to all children. And the addition is that extension of 7 days of what we call a modified self-isolation extends to their parents also. So I know that's an enormous mouthful and it's a bit confusing. So it will be clearly done on our website, and so that people are able to understand it. But really what we're trying to do is tackle those 2 things. We do have the advantage of being an island, and we're preventing first, doing what we can do to control introduction, and then making policies within the province to how we can mitigate that spread within the province by through unvaccinated people.
Thank you. And my next question is for Dr. Rahman, and that's just how much of a game changer is this Delta variant in terms of projecting and modeling for this 4th wave compared to waves in the past?
So thanks for that question, Ben. So the Delta variant has more secondary infections. It also has more severe consequences in terms of individuals that are infected coming in either to the hospital or to ICU. So I wouldn't say it's a game changer. What it is that it makes it more difficult to control, and so we have to be more vigilant in terms of public health measures, and as well in terms of our vaccination rates. So if you look at the outbreaks that we've had, they've been challenging. They've certainly stressed the public health in terms of contact tracing, but we're overcoming it. So, and I think we can handle things as long as we are following directions from public health and also stepping forward to get vaccinated.
Thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead and make your way to the mic.
Dr. Seviour, we're seeing a big jump in the hospitalizations today. A lot of people, we've heard the message that the vaccine is very effective at keeping people out of hospital. So can you give us an idea, is anyone who is vaccinated ending up in hospital?
So, Peter, this is something we really struggled with, and we actually had this conversations again, and myself and people out in the region. Because the numbers are so small, our hospitalizations are under 10, we don't release those numbers because it does identify people as being vaccinated or unvaccinated. What I can tell you, and I know that's not the answer you want, and I appreciate that, and that's why we always have to guard people's privacy. It's one of our primary principles in public health. Every time we call somebody and ask them for their contacts, they're trusting us with private information, and we really do everything we can to keep people's lives private as much as possible and to meet the press and the public's need to know. So what I can tell you then is that, when we compare, the people who are vaccinated and unvaccinated, and we keep them within their same age group, we know that, if you're 12 times more likely to acquire COVID-19 if you're unvaccinated versus vaccinated, 34 times more likely to be hospitalized with COVID-19, and 8 times more likely to die. And I think in the briefing yesterday, and I think I used that example because it struck me so much, because I don't think I'll ever forget when we had that terrible outbreak in Barrie, and I'll never forget how upset the Deputy Chief Medical Officer of Health when she described it. It was a real point for all of us across this country when Delta entered a nursing home and the decimation it made in that nursing home. And we've now had this happen in our province in a small nursing home. And as I said, we have nobody in that nursing home who ended up in hospital or who died. And the vaccine really protected them. There was transmission, but it protected them well. And as I've said before, this vaccine ain't perfect, but it's doing a damn good job.
And a question for Dr. Rahman. A lot of people are trying to figure out, at what point will we have enough people vaccinated that we can kind of put COVID behind us, that we'll have enough of that herd immunity? We saw from the slides there that Delta has obviously changed where we need to be, but what does your modeling show about what sort of number do we need to hit?
So that's a really good question, Peter, and it's being highly debated right now. If I could just change the construct of that question a little bit, because I think a way to look at COVID is how can we best look at COVID, and how can this pandemic be turned into an endemic, and what is it that we actually need to do so that we can live with the virus and yet do quite a few of the things that we actually wanted to do. So with the modeling, specifically, it really looks at really high immunity, and as Dr. Seviour mentioned, that there are breakthroughs with the vaccine. So the proportion of individuals that have to be vaccinated is very, very, very high to reach herd immunity. And I'm not quite sure if it's as quite a realistic goal. In other words, what we're trying to say is that maybe vaccines alone is not the answer, but the vaccines are very, very effective in terms of transmission. The vaccines are very effective in terms of not getting sick, right? And so what it's telling us essentially is as many people can get vaccinated, we can really help decrease transmission, decrease large outbreaks, and let's try to turn this pandemic into an endemic and see how best to live with that.
I just offer a systems perspective to that as well, Peter, if I may. We are spending disproportionately more effort on getting the last 8 to 10% of people vaccinated than we spent on getting the first 80% vaccinated. It is the long end of the tail, and we are determined to leave no stone unturned. We have clinics that move around, clinics that are available, walk-ins. There is no practical barrier, despite a lot of the comments that you hear, to anybody who wants a vaccine to get it. We have seen people prepared to drive 3 hours across this island, past clinics, rather than get a vaccine, for shopping at Costco or going to a personal event. That priority has to change. The amount of effort that we're spending on getting these last 8 to 10% is way more than we spent on getting the first 80%. But the data there on that graph shows very clearly that if we're ever going to use vaccine alone as a way of dealing with COVID-19, 88, 90% is where we need to be for a full series for everybody who's eligible.
We will now go to the phones. Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. This question is for Minister Haggie, specifically for Central Health, because that's where the bulk of our cases are right now. Given the new hospitalizations that were announced today and Dr. Rahman's predictions of an increase in ICU admissions, what sort of hospital capacity is there right now in the province and specifically in Central Health?
Thank you. Specifically in Central Health, they have beds available in their COVID unit. They have beds available within the region in intensive care, and the intensive care capacity across the province has capacity there. The challenge, I think, is staff, and Central Health have done a stellar job over the course of the last week or two in rising to the occasion. But Western Health and Eastern Health have offered them resources should they need it. So at the moment, we're watching it, but we are in a position, we believe, where we can cope from a clinical workload.
Thank you. And Dr. Seviour, just wondering if we can get an update on just how many breakthrough cases of COVID-19 we have in the province right now.
And I apologize, I do not have that. I've got a lot of numbers with me, but I do not have that one, but I can certainly get that to you.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Hi, this is actually a question sort of from yesterday. Maybe the minister could answer. I think some people are very worried about how they are going to be exempted from getting vaccines when it comes to passports. Can you give a rough idea of how that process is going to work?
I think I partly heard your question, Peter. If it's a question of how people have their vaccine assessed, I can certainly explain that. If it's something different, let me know. I don't want to go off on the tangent. Was that the right thread?
No, I'm asking what sort of process is being dreamed up for people who have a legitimate reason not to get vaccinated, how they go about getting that exemption. The Royal College, the College of Physicians and Surgeons of Newfoundland and Labrador have issued clear criteria for medical exemptions from vaccination. Those will be the ones that we will incorporate as acceptable under the vaccine passport approach. The details have not yet been finalized, but that's certainly where our head is. Those will be the only reasons accepted for an exemption. It will be a medical exemption. Okay, thank you. And Dr. Rahman, I think some people may have the impression that this virus is sort of on a path to forever mutate itself and outwit our attempts to mitigate through vaccinations, etc. Is it realistic to assume that things could actually get worse if new variants show up?
It's a great question, Peter. It's always possible, I guess. A lot of the parts of the world are not even have their first shot in terms of vaccinations. And so if the disease, if the SARS CoV-2 were to run in these populations, sometimes you do get breakthrough variants that are more lethal, even more than the Delta. That being said, if we can get vaccinated and look at the cross immunity that actually happens, in other words, right now the issue is that we were starting with a virus that was totally new, so the population was totally immune to it. And so once we are vaccinated, we will have immunity to some aspects of that particular virus, and hopefully the cross immunity there, whether it's the B or the T cells, will be enough so that we'll be able to handle new variants without significant disease in terms of ending up in hospital or the ICU.
Thank you.
I will now go back to Reach Reporter to see if you have one final question. Ben Cleary with NTV, do you have a final question?
Yes, I do, for Dr. Rahman. Why has the Delta variant changed the goalpost for the immunity threshold?
It really has to do with how many secondary infections that's been caused by the Delta variant as compared to the original variant, and that's referred to as the R0, or the reproduction number. So initially, if you're infected, your secondary infections would be about 2 to 3. Now it's about 6 to 8, and so because it's causing more infections, you require a higher immunity threshold to make sure that the virus doesn't propagate within the community.
Thank you.
Peter Cowan with CBC, do you have a final question?
I do. When we talk about travel restrictions, we do know that travel is the way that new cases largely get introduced. We saw that from the modeling. Why aren't we doing, for example, testing of even vaccinated travelers if we do know that we have been seeing some breakthrough cases of people coming back, they're fully vaccinated, and they're still able to get the disease and then introduce it?
So the issue around testing, I love the whole testing piece because it's really challenging, it's interesting, it's ever changing. So the problem with the test is it's a point in time. It doesn't answer all the questions. When I'm teaching young medical students, I tell them, if you don't have a question, don't do a test. So the test has to be timed right. It has to be done in the right population. It's not without its human resources element also. And so really we use testing in the best place we feel that it's most effective to answer our question, to prevent transmission. And I know it seems like, and I have friends who asked me, like somebody texted me yesterday actually and said, why aren't we just testing everybody? Because it's not realistic. It's not going to stop transmission. So otherwise, I would do it. But so I think it's the testing. You have to use it smartly, and you have to use it at the right time and on the right people. And we're always evaluating that, just like we're always evaluating. We've changed our travel policy, but for the moment, the way we're testing is working well for us. And a lot of focus on testing symptomatic people because we know to even do sort of surveillance with a test, you have to test such a large number of people that it's not humanly possible. So right now, I think our testing policy is serving us well.
Richard Duggan with VOCM, do you have a final question?
Yes, I have a question about the mandatory vaccines that was announced yesterday. Hopefully the minister could provide some insight here. I've heard a lot of chatter from people without the shot that are worried about their jobs with this mandate coming up. I know that in Quebec it's being reported that several thousand healthcare workers are facing possible suspension for refusing the vaccine. I know that the discussions are ongoing, but I was wondering if you could speak to the concerns that people have and maybe some insight into what repercussions are being considered for those that refuse the shot.
No, it is a very good question. It is a timely question. The short answer is we don't have some of the answers readily to hand with those questions. The Premier's office and Human Resource Secretariat have reached out to various representative groups, unions, and professional associations to seek their feedback. And Justice and Public Safety are working on a regulatory framework for that. But as yet, that process has not concluded. So, yes, we've heard the comments. They are not strange or unheard of for us. But I can't really give you a good answer just at the moment, Richard.
Peter Jackson with the Telegram. Do you have a final question?
Yeah, this is a bit of an odd question. I'm wondering whether any of you would be willing to take out your crystal ball and foresee any time when we might actually not be contact tracing with this disease.
Sounds like a modelling question to me.
Do you know what? I think, Peter, some of the public health measures will be the last to go, and contact tracing in terms of test, trace, isolate is critically important to any sort of infection. And it's there now. It was there before COVID. It'll be there even after COVID. It's an important tool for public health, and I think to some extent I can't see that going away.
And if I could add also, I mean, I think the national modelers, of which who Proton knows well, have told us that contact tracing is still important. And therefore I want to put a plea out to the population that when a nurse phones you and asks for the list or your contacts, to be patient, to be kind with those nurses who are working so diligently and so hard and such long hours. And we really do appreciate it, and know it's not always easy even to remember where you've been, of what you've been doing, but we really appreciate that you're working with public health and all those people in the front lines, and you being kind to them and answering their questions and all the hard work they're doing, because this is really what's going on now every single day in Bayvert and in the Twillingate area. So I want to thank all those public health nurses who are working so hard, and thank the public also for working with them, because it's really in working together that contact tracing works and that we stop the spread of the virus, because as we know, every case that we find and every tight circle that we can draw around it in terms of contact is every transmission event that we disrupt.
Thank you.
Thank you, everyone. Minister, do you have any final comments for today?
Yes, thanks. I'd just like to pick up on what Dr. Seviour said, actually. Public health nurses or contact tracers who call you are trying to help you. And the vast majority of Newfoundlanders and Labradorians have given them a very positive response. It is unfortunately sad, however, that there is a small minority who have not, and we've even had some cases of selective memory. So the contact tracing is key, and kindness and a bit of respect for the people who call will go a long way on all sides. With that, I'd like to just thank Dr. Rahman again for his hard work. The message from today is the same as yesterday. Get the shot. If you've had the first, get your second, and stay safe. Thank you very much for your time.
Thank you, Minister. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.
This is Jan. Jan sometimes visits her neighbor Paul. Paul has COVID-19, but doesn't know it. Jan also takes the bus. So does Mo, who's a frontline worker. So if Paul infected Jan, Jan could infect Mo, who could infect a lot of people. But wait, they all have the COVID Alert app. So Paul tested positive and entered a code in his app, which anonymously alerted Jan, so Jan stayed home and Mo went to work safely. Phew, close call. Help break the chain of infection. A message from the Government of Canada.
Of the preceding program, we now join the regularly scheduled program already in progress.
The following program is brought to you by Rogers Anyplace TV. Enjoy exclusive content for free. Visit RogersAnyplaceTV.com.
I started playing softball when I was 5 years old. I loved it because it was all about having fun with my friends, and it still is.
From little kids to adults to seniors, softball is a sport for everyone. Join us.
I'm Darren Hand. Please join me for Pocket Universe. On this show, we'll showcase artists, cosplayers, gamers, and discuss all topics of sci-fi, horror, and fantasy in Newfoundland and Labrador. This place is teeming with creative people who love to talk about their passion. That's Pocket Universe, Wednesdays, 8:30 p.m., only on Rogers TV.
The following program is brought to you by Rogers Anyplace TV. Enjoy exclusive content for free. Visit RogersAnyplaceTV.com.
So thanks for joining us today. Ask an Expert is a webinar series created by Team Grow NL and Connector NL with the St. John's Board of Trade. So my name is Tanya Heath. I'm with Team Grow NL. We are an initiative that aims to help local businesses meet their human resources needs by providing key information regarding immigration and the attraction of expatriate Newfoundlander and Labradorians living abroad. So on the call today as well is our Connector NL team. So it's Shanna Mugford and Ashley Burge. Connector NL is a program that helps individuals that are new to the provincial workforce grow their professional network and connect with career opportunities here in the province. So what this series does, it allows industry experts and employers gauge with job seekers that are interested in working in various sectors of Newfoundland and Labrador. Today we'll be focusing on the aquaculture industry, and we have with us Mark Lane and Sheldon George, and I'm just going to take one moment to tell you a little bit about them. So Mark has lived in Holyrood, Newfoundland and Labrador since 1982. He holds a Bachelor of Science from Memorial University, an Advanced Aquaculture Diploma from the Fisheries and Marine Institute, and an Applied Business Information Technology Graduate Diploma from College of the North Atlantic. Moving on to Sheldon, he was born and raised in Carbonear, Newfoundland and Labrador, and graduated from Memorial University with a Bachelor of Science degree, majoring in biology. After achieving a Bachelor of Science, he continued his education at the Marine Institute to complete the Advanced Diploma in Aquaculture in 97-98 and started his work in the aquaculture industry in New Brunswick. After almost 10 years in New Brunswick, Sheldon returned to Newfoundland, continuing work in the aquaculture industry. So thank you both, Mark and Sheldon, for being here today. I'm sure we're going to learn a lot from your presentations. We have some very interesting participants waiting. So how this session will work now is Mark and Sheldon will present for about 10 to 15 minutes each, and then I'm going to pass it off to Shanna, and she will take you through a question and answer period. So feel free to type your questions into the chat box during the presentations, and we'll address them afterwards in this period. So that's it for me, so let's get started with Mark.
Well, thank you so much, guys, for the opportunity. It's certainly an honor. I'm very passionate about aquaculture and what it brings to not just the province of Newfoundland and Labrador and the rural communities that we operate in, but certainly to the world. We've got a great responsibility as sustainable seafood farmers. We've got to feed a lot of people, and in doing so, we create a lot of economic business opportunities here at home in Newfoundland and Labrador. If it's okay with you, I'd like to actually start with a quick little video, and it kind of sets the scene of what we'd like to have a discussion about today. So just bear with me for a moment. I'll share my screen, and just bear with me. Okay, hopefully you can see this. Can we see this? My disorganized desktop. And what I'd like to do is just a quick 3-minute video, and then I'll get into my presentation.
I live in Milltown, but I work in the Coast of Bay. For me, it's a great place to live and raise a family.
Some people will even live in New York, some people probably in Montreal. Guy, Sandyville. I love it here. It's so quiet, peaceful.
Living in Harvard is a way of life. People who are from rural communities like to stay in rural communities.
There's a lot of beauty that we don't see every day.
It's the Atlantic Ocean. It's pristine waters. Cold, clean waters of Newfoundland is what makes the area around here a great spot for farming.
This is the best news story. Outside of the overpass is down here.
Farm salmon is a heavily regulated industry, and you know with farm salmon that you're getting a quality, fresh farm product.
It's more natural, they're free swimming. Farm salmon is grown in deep, cold water, really well filtered, especially off of Newfoundland. We have a lot of current that keeps everything nice and clean.
I remember the moratorium. I remember a lot of sad faces around, a lot of people wondering what they were going to do next because the fish plant had closed down. That was the biggest employer.
People were devastated. They were losing their homes and their cars. When you are in your late 50s and you've worked all your life and you've got to move away just to try to keep from losing everything you got after 40 years of employment, it was heartbreaking.
Since agriculture moved in here, this town has changed dramatically.
I think it's a godsend to this community. Not only to this community, but for most of the Southwest Coast.
Everyone that lives here, they see a lot of spin-offs that the industry brings. The restaurants and the hotels are busy. The amenities and services that are here because of the industry.
I don't know what would have happened to some of these communities had the agriculture not come on stream.
I always say it's all about the fish, but it's also about the staff that works on the farms as well.
You really had to see aquaculture to appreciate it. You know, you had to see the positive effects that it has on a local community. You had to see all the people who are employed by aquaculture and just even see, you know, all the practices that are in place to ensure environmental sustainability. There's a lot more than what you read on the news when it comes to agriculture.
Farming is a 365-day-a-year job, so you're with your co-workers every day of the year. They become your family, your farming family. There's no better sense of feeling than seeing a nice fillet of salmon on a shelf or on someone's plate, knowing that people on the farms took pride in producing that product.
So as you can see from the video, I just want to give everybody an idea of